Then John, do we need to say something as far as the recording goes and just kind of the how that works? All right, we're halfway, 16. Once again, the invite is open if you want to just turn on your camera, say hello, or let me see your faces. And you do not need to, but you can. I shall unmute. So welcome everybody and we'll get started. We're expecting 30. So let's see. Let's go ahead and I'm going to mute everybody. We got it all. Okay, so I am Jennifer Wright. I'm a certified nurse midwife. I'll be the talker tonight, the voice of your childbirth education class. I've been with Kaiser 8 years. I've worked in a vast variety of practices, so including New Zealand, Indian Health Service, private practice midwifery, and now Kaiser. And so part of this childbirth education class is sharing with you the information that I wish I had time to discuss with you in our very busy clinics. And so that's part of the reason that this is happening at 6:30 at night, and that I work a full clinic schedule or my call. And then this is extra time outside of my full-time job. So I know it goes until 9:30. We will be very busy all the way through. So just make yourselves at home and comfortable. And there's very little, I'm not going to have you meet in breakout rooms or really interact. We have 30 people that are on tonight. And so it'll mainly be information coming out at you, which I find most people that's what they're hungry for. So the one way that you can communicate with us is on chat. So the chat function is the little bubble that's up top. It says show conversation. Everybody should be able to see that. If not, simply unmute and just shout out a question. That's okay too. Our chat person tonight is going to be Sunny. Do you want to say hello?
Hi, I'm Sunny. I'm one of the labor and delivery nurses here, and a lactation consultant. So if you guys have any questions that you just want to type while Jen's talking, feel free. If I don't know the answer, I'll just come knock on the door and ask her. But yeah, if you guys have any questions, please feel free to ask.
Wonderful, thank you. So Sunny's at a computer that's actually out in one of our nurses' stations, so it's she can hear me, but she can't unmute. There's no microphone, so she'll be the voice behind the chat tonight. Okay, so full 3 hours. I recommend also now that I can see beautiful faces and I know there's real humans out there. If you want to turn your videos off, hello. I recommend it. It'll make the videos go a lot smoother. So welcome everybody. So I've been with Kaiser 8 years, but I've been a midwife for 22. I love what I do and I love educating about midwifery and physiological birth and how this process is going to work to bring your kid out into the world. But I think you'll find that part of this class too is a reminder that it's parenthood. You're going into parenthood. The birth is just a rite of passage to get to that parenthood spot. So I am actually in a postpartum room tonight because our labor rooms are all full. I think that crazy full moon and eclipse is coming up. So I'm sure that's why our rooms are full. But I think it's appropriate to show you the postpartum room because it's also going to shift you into parental mode, right? And thinking about, oh yeah, this is not about the birth of the baby, but this is about becoming parents. So we have, just to kind of orient to our hospital, we have 9 labor rooms and we have about, I think there's 20 of the postpartum rooms. So you'll be in this postpartum room, usually a full 48 hours, 2 days after birth. If you're an experienced mama, then you'll be in there for about 24 hours. Obviously, we're not going to send you home at 2 o'clock in the morning. Well, so you would spend the night with us in that case, and we'd send you home in the morning. Most of the time, if you're being discharged home, it's going to be about afternoon or noon, just so that we can get baby evaluated, mama evaluated, and everything going that way. So welcome. So let's do a little tour. I have decorated the room also. Just mute here. Let me take apart here. So there we go. So this is one of our postpartum rooms. So when you come in here, the light's doing funny things. So we have a bed. The difference is we have a cot for baby too. And then we have a sleeper chair over there for your support person. So I've done a little bit of a blend, kind of how to pack for labor and delivery, but also postpartum. So one of the things that you'll notice in this room is the cot for baby. So you will get a nice little welcome packet, goodies from Kaiser. And then downstairs, oh, no, it's okay. I've got it. I'm got used to that. One of the things that's down here is the Pampers, the wipes, and more blankets. So you don't need to bring those things for the initial time. Over here, we have the whole major players of tonight's class. So meet the pelvis, meet cervical dilation, and meet the uterus. And there's a little baby inside there. So let me see if I can show that to you. Okay, so bag of water breaks, right? That's where this is the cervix, this is the uterus. So this is going to be inside your pelvis. And so we access the cervix through the vagina. Okay, so inside here is the vagina, and then there's the cervix. So inside there, you can see the baby starting to crown. And then as the baby, this one's going to come out in the sac, which is so beautiful. So that's what it looks like. There are 2 layers to the sac. And we're going to talk about baby's head position and how important that is, that they're lined up with baby's back towards your front so baby can come down and turn a corner with their head. They have much more range of motion. This will make sense as we go through the class, but I just want to introduce the parts, okay? And then baby comes out of the sac and is attached to the placenta. That's the cord, and baby goes right on your tummy, and then the placenta comes out. So those are the parts. If the baby comes out a different way, the little zipper on here is kind of an illustration of where a cesarean incision would be made. So here's the pelvis, so it's just above the pelvis. And the cervical dilation is just how the cervix is moving through through labor. So fingertip all the way open, which we say 10 centimeters, but it's basically that we can't feel it anymore. Okay, so there's our players. Baby's very important in there. This is a depiction of kind of the road to labor. So Penny Simpkin is a physical therapist who made this drawing. So there's the yellow brick road, and then there's the super highway, and then there's this bumpy road. And so what you can see is that there's a lot of time going by. So she's got the clock in different spots, and the different spots where there's dilation that's going on too. The bumpy road is when baby's not in the best position. Like I said, that baby can't come around the bone and move into your pelvis. So that's where there's a little bit of back pain that can come and different things to try. The superhighway is more of a high-tech process when a woman gets an epidural, and we'll watch a video about that tonight. But the time still takes a little bit longer, but there's just not as many shifting going on because mom's usually just resting with the epidural. So I love that. So Penny Simpkin, the roadmap of labor. So other things in this room. So you can bring your own blanket. I'm a big color person and cloth person, so I'm a big advocate for bringing your own. Maybe you want your own sheets too, just to have that smell, your own pillows to have the smell of home. Over here, there's the menu card. So we have room service for our admitted person, and then your support people will go down to the cafeteria, which is on the second floor. They're only open until 5:30, 6:30 p.m. And only open at 7 a.m. So having some snacks is a good idea too. So I've got a little snack table over here. Sorry, my camera seems to take a little bit of time when I move the computer. Did it go? I think it's shifting too easily. There we go. It's a little snack table. So maybe you want to bring your own cups, a special cup. Chamomile lavender tea is really, really soothing. Snacks, salty snacks. Maybe you want granola bars. I highly recommend, and I swear I don't get paid by them, but the Liquid IV, it's just electrolytes that go in water. They taste pretty good. Not as many artificial colors as in a Gatorade or a Powerade. So you can definitely bring snacks with you. So also have the balls over there. So we have the yoga ball and a peanut ball. So those we supply. So you don't need to pack that in your car. You'll have enough things to bring in. But those are really good for being up out of bed. Or if you've got an epidural, the peanut ball is wonderful for helping to shift your pelvis around too, to allow for baby to come. Again, another blanket. Maybe you want to bring some of the little fairy lights just to, I don't know, bring a little bit more of your own personality to the room. This is the sleeper chair, so it folds out to being about like a twin bed. You may want to bring your own sheets. We will give you sheets, but they're the hospital plain white sheets that are kind of starchy. Sense of humor. Maybe you want to bring the magic 8-ball, you know, is my baby coming today or tomorrow? Will it be today? And then you can ask it. It says, as I see it, yes. And then just depiction of time, bananagrams, Scrabble, electronic games, just because labor can take time too. And if you have an epidural, you will be able to probably sit, if you're not resting, napping, to sit and play a game or solitaire, watch movies, so pack that. You also may want to bring your speaker and a playlist, so you don't have to skip that song, get music that you really like. Down below here, we've got the cooler bag, and that's important too. If you're going to take your placenta home, you'll definitely want to have a cooler ready to put it in, and usually we recommend it goes home the first day. I think massage is important. These are tennis balls in here, and they're really good for your support person to rub on your back. Sometimes it gets really hot, so a nice fan is good to pack. Aromatherapy will support you for that. Bring your own diffuser, your own oils. We do have some. I usually have a little lavender oil and clary sage in my pocket when I come around. But you can definitely bring scents that smell good to you. And the bathroom in here is a little different. I recommend wearing your own clothes. Somehow, when you come in labor and we give you a hospital gown and you go and change and then you come out, I've seen women forget their personalities in the bathroom and they just become a patient in the bed. And you're not. You're going to be a woman in labor, a person giving birth. You need to be empowered and you need to feel yourself. So wearing your own clothes can kind of add to that. It's a little just a little mindset, but it is important, right? You know, ours don't say property of Kaiser, but you know, that message, right? We give you a gown that says that it belongs to us, you know, that we totally will let you wear your own clothes. Frida Company has some great gowns now that are out there. So the bathroom has a little shower and toilet. We'll bring in a chair. So the difference between this bathroom, you'll see a picture of our labor tubs. We have 2 rooms that have a labor tub. So I'll show those later. But the difference in here are all the postpartum things. So we've got pads. These are ice packs. We have the lovely disposable undies that are in here. And the squirt bottle. That's a must after you've had a baby. There's still going to be some mucus and some bleeding, and so using warm water with a squirt bottle really feels good and just keeps you nice and clean. So once again, I've got little in the shower, I've got the little lights in there just to give it a little bit more homey feel, right? It's a hospital room. We try to hide as much of the items that we can, but if you feel more at home, then you're going to feel more empowered also. Okay, so were there any questions from that tour? Got lots more that we're going to go through tonight, so thanks for that. Okay, and in the chat, there's a couple links. There's one of my favorite animated birth videos that a lot of times I like to show, but tonight we'll focus more on the slide presentation and the videos that are in the presentation. But the animated birth video, this physiological birth, and it's just a good reminder that on any given moment, any given day, all over the world, somebody's giving birth, right? So you're becoming parents, just so that it's just that reminder that you're not alone and that our bodies are made to do this. Because we walk upright, we need a little help. You need a midwife, you might need an OBGYN, but that video I highly recommend. The other link I put in the chat is for the KP in Hawaii maternity section, so specific information to us. There's also La Leche League, which is the breastfeeding community, and then Spinning Babies. And Spinning Babies is a way for you to have a tool of how to avoid that bumpy road of back labor by in your pregnancy doing daily exercises that are recommended and weekly exercises to help your ligaments, your fascia, your muscles in your pelvis all be perfectly lined up so that baby can come through that pelvic bone. So spinningbabies.com, I highly recommend that one. Okay. All right, so now I'm going to share my screen and we'll dive into the actual class tonight. From the beginning. Okay. So, Sunny, if that's not looking right, come in and tell me. So welcome everybody. I have Crystal's name on there. She's helped me before, but Sunny is helping tonight. I love the beginning of this slide because what is it showing you? It's not showing a newborn baby, but actually grown children. And again, a reminder that we're going to talk about childbirth education, but you're actually becoming parents. And I think when we discuss childbirth education, it's important to remember that this the childbirth piece is to get to the parenthood. A reminder with Teams, so the chat function has a little blue arrow that's pointing to it. You should be able to type in there. If you're unable to type in there, please just unmute and ask a question. I should be able to hear you. During this part where I'm sharing my screen, I do recommend that you have your video off. I think our videos will run more smoothly with that. And then keep in mind that you can see who is on tonight. And so if you recognize a name from your childhood, please respect that now you know that, yes, they're pregnant also, but to not go on social media or share that information. By all means, if you want to reach out to each other through that chat function, you sure can, but just kind of keeping confidential. And questions are welcome, and keep in mind, some people get intimidated asking questions, but a lot of times the question that you have is maybe a question somebody didn't even know to ask, right? So please keep Sunny busy with those questions. I am at the YPO clinic, so if you want to come see me there, you sure can. I have 2 days of clinic, and then I'm 1 day shift here and 1 night shift. So I may be seeing you when you're in labor. I also want to shout out to Hilo. I think we have a couple that's on from Hilo tonight, and Maui. So the specific labor room information is going to be different for your hospital. So make sure at your next clinic visit to have a chat about the rooms. The items that I showed you for packing, you can definitely bring with you to Maui also. And the items that I showed you that are in the rooms that we supply for you, the pads, the peri bottle, the diapers, the wipes, Maui and Hilo will also have those. So just a little bit different. And then everybody except for a couple are in your 3rd trimester. So this class is best when you are thinking about how is this baby going to get out of my body? So 3rd trimester, so after 28 weeks, sometimes if you're a little less than that, it just seems too much, right? Because you're still enjoying the pregnancy. But for the most part, everybody was into their 30 weeks, and we have a few that are due any day. So I'm glad you could all join us. COVID updates, so visitation and labor support has been relaxed. So 2 people can join you. So we still have a limit on who can be in the room. They need to be over 14 years old, but you can have 2 people here, and we're no longer checking vaccine status, and we're no longer checking a COVID swab if they were unvaccinated. So that's great news. We will still test you when you come in. The admitted person will be tested for COVID. So we're also doing RSV, the respiratory syncytial virus that has been in the news recently, and we also test for flu. So we're really lucky that we can do those 3 tests with the admission. If your support people are feeling unwell, have a backup plan, because we really would ask that they not join you if they're feeling sick. Even if they have a test and, well, it's not COVID, but it still could be the flu or that RSV. So we just ask that you have healthy people with you. We do want you to wear your mask while you're in the hospital, and they do have them at security when you check in, but you can bring your own. Once we have established that you're negative, we are a little bit more lenient, but you will notice we are still fully masked. And if you were COVID positive, we'll be fully in the PPE. So that personal protective equipment. So I really advise, I have two things that can keep you safe from COVID. One is the mask. So I know it's not mandated, but in third trimester, you really may want to put it on. Just especially as we're going into the fall, the colder weather, more indoor time and family gatherings. So you may just want to keep that mask on and still limit the intimacy that you have with big groups. And then the vaccine is highly, highly recommended in pregnancy, and the booster, the new booster that's out. So it is, when you do have COVID in pregnancy, it seems to affect the placenta. So that's why the vaccine seems to give an extra layer of protection. If you get COVID in pregnancy, we will offer you the antiviral medication, like Tamiflu is for flu. We offer Paxlovid or whatever the antiviral is for the particular variant of COVID that we've got. So those things will be offered to you, and the vaccine is highly recommended. It does seem to reduce the risk of a hospital admission during a COVID infection. Keep in mind, in pregnancy, your immune system is already compromised because your body is not wanting to fight off that baby, right? So that's why you are more prone towards illness in pregnancy. So consider the vaccine, update your boosters, and just be safe as we go into a holiday season. Okay. So childbirth education, I just want to put it into perspective. If you look at your pregnancy, that's generally 280 days. Breastfeeding is going to be longer than that. And then if you look at the little tiny sliver, the actual active labor, which we'll talk about what that means, is going to be about 24 hours of your life. And so another perspective is when you add the parenthood in there, look at all those days. The breastfeeding's still much bigger. The pregnancy's looking smaller, and still just a sliver, 24 hours, right, is your labor and birth process. So to me, that's the emphasis on that parenthood is so important, right? This is not just about your baby being born. Your kids also grow up way too quickly. So those are my twin boys, Zanskar and Teo. They graduated from Kalaheo in 2021. One is in his second year of college in Colorado, and the other one is finishing his first year of college in New Zealand. So I just want to remind you that every day with your kiddos needs to count, right? Because all of a sudden, that same feeling that you get when you bring your newborn home, right? There's that message out there that it's hard, postpartum is really hard. And when you bring that newborn into your house, there's a little bit of grief that may come. And that grief is for the life that you had before you had a baby. You knew yourself. Maybe you had a career or a job, or you just had a relationship with your partner that was rich, and now there's this baby, and now you're becoming parents, and you don't know who you are as parents. So when you are early in those postpartum days, there is a little bit of grief that's there for your life beforehand. So I like to warn you about that, because some people feel really guilty when they're having that feeling for how life was. And then you're going to learn how to be parents and how to have this baby in your life, and you'll eventually get to a spot where you're like, I can't even imagine how it was before. And then they graduate and go off to college, and that same feeling comes back, but it's the grief for your family life. And now the wonder is, who am I now that my kids are doing their adult things? I have adult children. So who am I now that I'm not a mom daily? So remember this little slide that they grow up way too fast. So make every moment count. Don't be in a rush. for them to go to the next phase of life. Sometimes that newborn phase, though, gets a little old, I'll tell you that. So at Kaiser Permanente, we're here for you. So this class is part of making sure that you have a satisfying and safe pregnancy and birth experience. And our whole team is going to go make every effort to meet your pregnancy, birth, and health needs. Okay, we are doing shared decision making, which is lovely, which means if you need an induction, for example, here are the options that are available based on your cervix. This is what we would recommend. What are your thoughts? What do you think would be best for you and your body? So having a baby with us, there's a lot of benefits to that. So one of the big benefits is that you're the center of care. I shared with you that I've worked in a lot of varieties of settings. And one of my favorites is how we work at Kaiser, where I am here as a midwife, the doctor is here as the physician. And so decisions are being made based on you, your body, and your family at the moment. So it's not that the nurses are, the physician or midwife is maybe in clinic and they're managing remotely and the nurse is managing at the bedside and then they call in the doctor at the last minute for the birth. You're not going to have that here at Kaiser because we're all here. And so we're not making a decision based on, well, I really want to go to my kid's, 5-year-old birthday party or whatever, right? You are the center of our care. We actively promote breastfeeding. Our breastfeeding rates are great and very high. Part of that's because we support the skin to skin. So when baby is born, baby goes right onto your chest and stays there. We delay the cord clamping, let baby really transition just right on your warm belly. And then that allows for breastfeeding to happen a little bit more quickly. We have 24-hour rooming in. So those movies where there's the window and people are pointing to their babies, that doesn't exist here. You saw the cot here in the room. The baby stays with you. We totally want your family, your partner to participate and be involved. And we will show you how to swaddle baby, put on diapers, and let you do as much as the care as possible. We have a dedicated team that's here. So the 3 providers are OBGYN attending, the midwife, and a resident. So the OBGYN attending has a big job. They're covering labor, the emergency room, our surgical patients, any mothers that might be admitted in pregnancy, and also postpartum moms. So that's a big job. The residents are not students. They are medical doctors fine-tuning mainly their surgical skills. They do learn a lot with us too, as working with the midwives and also from the nursing, being new to their careers, but they are doctors and not students. So they also cover the whole hospital that I described with the OBGYN. Midwives, our main focus are our labor rooms, our 9 labor rooms that we have. You'll be seeing most of the time, even if you are considered a more high-risk mom, you may see all of us in there, and that when it comes time to birth, if you're pushing out your baby, we can still be there with you to normalize that process. I have a whole slide on midwifery, so we'll talk about that too. Pediatrician, so the pediatrician that you see here in the hospital is going to be different than the one you see in the clinic. So they are here, they're called hospitalists. So they will round on your baby and we will make sure to get you scheduled for outpatient care with the pediatrician of your choice. Our lactation consultants are here 7 days a week, usually during the business hours, but all of our nurses, all of our postpartum nurses and our midwives, we're all trained to help you with breastfeeding. So most of the time we can help. It is an art. That is why I put on there the La Leche League information. It's just because it's about the art of breastfeeding. Some babies latch right away. Other babies, they need to learn. I usually blame the baby though if it doesn't latch, and give it a try if it doesn't work with the first one. But we have all kinds of tricks that we can help you with. Nurses, We have the maternal fetal medicine specialists too that are here and available to us if we have a high risk situation and need to call them in. We also have a full newborn intensive care unit called a NICU. That is for babies that need special needs. It's here on our 6th floor. It's just down the hallway. So our moms can very easily access their babies, and we get you there as soon as we can. You definitely need to be negative for COVID to go in there. So that test is important. And also the vaccines are important just to help protect the newborns if your baby goes there. So just an example, Queens can only do 34 weeks and above for births. And Castle is also, they don't have a NICU. Our hospital is unique also in that we have a complete intensive care unit if mama also needs that higher level of care. So both mom and baby would stay in our hospital and we would be able to meet the needs for that higher level of care under our roof. So one example of that is early on when people were getting quite ill with COVID, that we had babies that needed to be born very early and go to the newborn intensive care unit, and mamas that were in the ICU for the COVID care. So we're very fortunate to have such a high level of care that we can give with multiple different teams. So this is the picture form of how our care is. You are in the center and everybody's around you. So it's a collaborative practice. So we also have our nurse anesthetist. So in labor, your nurse, like Sunny, who's on chat right now, she's going to be with maybe 1 or 2 clients at a time. If you start to push or your labor is more complicated, then it's one-on-one nursing. I mentioned that the nurse midwife then is the next one that's there, and the OBGYN. So sometimes you'll have both midwife and OBGYN, sometimes just the midwife. And then everybody else is around you there giving you support. So this is a little bit more detailed video on midwifery. So let me just play that for you.
The first step to having a healthy baby is having a healthy pregnancy. At Kaiser Permanente, new moms have many great choices when it comes to prenatal care, labor and delivery preferences, and highly trained providers, including certified nurse midwives.
I didn't really know what a midwife was. And what I liked about it was it just felt very personal, and it felt like she was there kind of as more of like an emotional support person as well. I feel like during the prenatal process, she was there for me, of course, to answer anything that I was feeling throughout. And then she also got to know me, I felt like on more of a personal level too. So we kind of would chit chat about life as well. I had Connie and Linda as some of my midwives here at the hospital, and they were always coming in and just kind of telling us what exactly was happening. So they were very transparent, but then they were also reassuring and just would let us know what solutions we could go from depending on how the baby was reacting to everything.
The midwives do about 75% of the vaginal births here at Kaiser. We do about 120 to 140 births a month. So we do a lot of the deliveries. We actually take care of our lower risk moms who come in labor closer to their due date, and we support them in labor. We do the deliveries. We take care of them postpartum, and we see them back in the clinic 3 or 4 weeks post-delivery. And we love that, and our families love that too.
I would really recommend having a midwife during your pregnancy experience, just because they have the expertise that the doctor has, and then they just bring more of like a personal and emotional touch to it. They treat us like they didn't have any other patients. It felt like they really cared about us and we weren't just a number.
So what's really, I think, wonderful here at Kaiser and the way that we work so closely with our OBs is that our obstetrician gynecologists have a really good understanding of what midwifery is. And one of the differences that I use to explain between midwives and the OBs is that when you come into clinic to see me, I'm asking you to tell me how you are, right? To empower you to tune into your body and tell me what's happening with your body. Where OB's training is to tell you how you are when you come in, right? That they're going to look at lab values and tests, and you come in to find out how you are. So what's nice with how we work is that our OBs have an understanding of the midwifery. And so for somebody that is healthy and well, they can also treat the pregnancy as a low-tech pregnancy and healthy and well pregnancy. And then as midwives, for some of our more high-risk mamas, we can bring that normalcy in, but we also have the medical understanding of what's going on in the pregnancy too. And then in labor, sometimes babies come all at the same time. And so our OBs, even in a very normal labor experience, if they do the delivery, they'll come out and say, I was such a midwife in that room. And we'll say, what does that mean? And they say, I left the lights really dim. We didn't break the bed, right? The bed's just lowered. And we just let her push to her own rhythm. You know, it's beautiful, which I think sums up the midwifery and OB difference quite a bit, where our training is 2 years of normal and recognizing the physiological and supporting the normal birth, and also being ready for obstetrical emergencies, where the OBs have a very shorter span of the normal, and then they're focusing more on the surgery and the abnormal management. So it's a lovely blend between us here in the care that you get. So one of the benefits of this online class is learning amazing information about your own body, pregnancy, labor, and delivery. I already introduced the key players, right? The pelvis and your uterus and cervix. So we've got some of those words out. This class is also going to discuss options for handling pain. And we'll watch actual videos and you'll see different methods that are offered to help a woman through her contractions. And you'll learn about our family birth center, so you'll know what to expect. And when you are prepared and you're collecting this information, you're going to develop trust in your team. And that's the first thing that I want, is when you come into the door, just in this class, hopefully the message is, we got you, right? We're going to be there for you, and that you don't have to come in with a distrust. One of my favorite shows, and if you want to watch birth and realistic birth, it's called Call the Midwife. It's from the BBC, a British production. It's based on a book from a real midwife and her experiences in the 1950s of London. Historically, it's an amazing time where babies were born at home with nuns, and then the nurses became the midwives. So that was a shift, but still at home. And then the hospital setting came in, a more medicalized childbirth. So you really see a wonderful kind of historic picture of birth, recent history, right? Because birth is as old as time. And one of the episodes had this lovely quote about, we can only prepare, but we can't predict. So that's part of tonight is, let's say you are planning to come in and be 6 centimeters and your water breaks and push a baby out in 20 minutes. I want that for everybody, but sometimes it doesn't happen like that. So even though that is your idea, your wish, that you also prepare for what would an epidural look like, and at what point would I ask for an epidural or IV pain medication, just so that you're prepared, right? You can see both sides. When I gave birth to my twins, I went in, even though I wanted them to not go to the NICU, I still went in and did a tour so I would understand. And I had many conversations with my OBGYN about the likelihood of a cesarean and what that would look like for twins. So that's part of being prepared, because you can't predict what's going to happen in the moment. This is a beautiful time-lapse video. So There will be a newborn baby that's just born, but you don't actually see the birth in this video. I will warn you when we get to the videos where there's actual birth, because I want to respect that some people are not ready to see that. That's okay. This one is just a time lapse. It is a beautiful movie from one of our Kaiser families, so it is one of our rooms. You will see the familiar drive to get to our hospital, her going up into our elevator, so it's very familiar. And I just think this family has so much positive and joy just in what they captured in this video. So enjoy.
Happy days
You
are
want to push?
coming my
You can push
way.
me around.
Happy days are coming my way. Happy days are coming my way. Happy days are coming my way. Sorrow sang its funeral.
What a wonderful birthday present.
The morning comes.
Ellie Bear!
brings new.
You know what she did this morning?
She fell.
She tapped on my tummy and kissed it 3 times. What, Ellie?
Happy days are coming my way. Happy days are coming my way. Happy days are.
Big sister! Number 9! Shut up!
What? Are you guys? Here we are, we're on our way to the hospital. Trisha's been having pretty regular contractions. Ezra, smile. Bye, everyone. Seven pounds, 15 ounces. Is that what you expected, love?
Hey,
Intenso.
Intenso. She is my superhero.
Happy days are
here!
here!
Yay! Woo-hoo!
All right, so I want to push at the beginning is her first pregnancy. The baby was what's called breech. So we'll talk about cesareans, but sitting upright in her pelvis where the head is up towards her top. And so she had a C-section, planned, scheduled C-section for her first delivery. And then what you saw in the video was a trial of labor after a cesarean and then a successful vaginal birth after C-section. And I think that's just important to understand that with your first baby, if there's a C-section for whatever reason, we do support the vaginal birth. The door is not closed for a vaginal birth as long as the surgery goes well. And definitely our surgeons would tell you if there was concern for laboring after a C-section. So tonight, we're going to go through pregnancy resources. We're going to talk about your amazing bodies, discomforts in pregnancy, healthy eating and exercise, fetal movement. We're going to talk about warning signs and pre-labor signs. Then we get into the signs and phases of labor, coping techniques, options, labor support, cesarean delivery, and postpartum. It's a lot to cover in 3 hours. Historically, this class was 6 to 8 weeks, once a week. So we have condensed it and we're still doing it online. So it is not at all going to be your certificate and that now, you've got all the information, but hopefully I'm going to give you enough information and little slivers or breadcrumbs to say, I want to follow that trail. I want to look a little bit more at that. Okay. So pregnancy resources, the phone numbers, I highly recommend you put in your phone now, if you've got them right next to you. Labor and delivery, 808-432-8552. There will always be a human that answers that phone. And those of you that took the Welcome to Childbirth education class, you know about that number. That is always going to be our ward clerk usually, or one of the nurses that answers that phone. You will not get the press 1, press 3. So let that phone ring. There are 3 different lines that come into that. The lactation services, 432-8518. Those are available to you at no cost for the duration of your breastfeeding experience. So that's an important phone number to have also. KP Maternity, so I've left a link in the chat to that, and that is lots of great information. There are also videos from our other midwives about vitamins, about exercising. So if you are an adult learner that likes looking at videos, kp.org maternity has, it's almost like a community college course catalog, right, of just all the classes and the information that's available. You should have also gotten the ACOG book, that American College of Obstetrician and Gynecology book, and that book is also full of information. And the reason I'm tailoring you to the kp.org and the ACOG book is because everything that is posted online for kp.org and in that book has been well researched. The problem with Google is that you can get opinions and it can get very confusing. So please stick to those resources and the other ones that I give you tonight. So we do have the Welcome to Pregnancy Care with Kaiser class, which is best when you are earlier in your pregnancy because it goes through the care that we give you and then more importantly, the care that you do for yourself. So thank you to, there were quite a few of you that have taken that class also. Thank you. There's a class of newborn care, and that one is a PowerPoint presentation that's recorded. So that one is not live, but it is given by one of our very experienced postpartum nurses. There's also healthy pregnancy and meeting with health coaches that's available. And then my favorite website, and I've already mentioned it once, and I'll probably mention it several more times, is the spinningbabies.com. That's daily positioning, hip opening, weekly exercises to really get baby in a good position throughout your pregnancy so that birth can go a little bit more easily. There's also the blue folder that we gave you at the beginning of the pregnancy with the what to expect when having your baby with Kaiser. In the very middle of that book is, they call it a birth plan. I really like to avoid the idea of a plan. I like to call it birthday desires, birthday wishes, birth ideas. Do you understand why I'm saying that, right? Because this is not something we can necessarily plan. So, call it the birthday wishes, and then that way it's easier if baby creates a situation where a different pathway is needed. And then please bring questions to your next visit. We love questions, especially, I mean, we're seeing you weekly at 36 weeks. So those are the questions about labor and delivery. And we do have the what to pack list too. So, and it's in that what to expect booklet. So let's talk about your amazing body. So this is a baby that is perfectly aligned. The cervix is right underneath the baby's head, and you can see the vagina. There is this tilt, right? That baby has to drop into the vaginal floor and then turn a corner to come underneath the pelvic bone. And so what you have is the uterus. So your uterus is usually the size of your fist, and you can see how thin it gets toward the end of pregnancy. You can see baby sitting on your bladder and then also on your rectum, right? Look at how the spine is affected, how the spine is much more bowed and curved, right? And then we have the fetus or the baby, the umbilical cord, the placenta, the little toes, they're so cute. The amniotic sac, which I showed you when our little pretend baby was introduced. And then your cervix. And then the vagina is the opening. So those are all your parts, kind of from the side angle with a perfectly lined up baby. So the things in this picture that are going to influence your labor are your pelvis, the power, your passenger, and then your psyche. So that's one of the ways that they teach it to us in midwifery school, or also nursing, obstetrical nursing, or our OBGYNs. So the pelvis is your bones, and that's what you're born with. And we will say that you are proven to 7 pounds, 15 ounces, like the woman in the video, right? Once baby passes through that pelvis, you are proven to that weight of the baby. So we don't know what your pelvis is going to do. Spinning babies is going to help so that pelvis can open either up top to allow baby to come through, or down below to allow baby to drop into the pelvic floor. The power are the contractions, and that's from your uterus, and those contractions. Oxytocin is the natural hormone that's being used, and it's actually squeezing the uterus, but it's also pulling up that cervix, right? So the cervix is not just opening, but it's also shortening. So the power we can influence, so we can give the synthetic form of oxytocin, which is called Pitocin. And we have a lot of respect for Pitocin here. Takes about 20 minutes for it to work on the receptors of the uterus. It goes through your IV. And so you will not see Sunny or any of the other nurses increasing that Pitocin any more frequently than 20 to 40 minutes, 30 minutes, just to allow for it to take time. If your own labor kicks in and we turn it off, it takes 5 minutes to clear it out of the system. So we can help the uterus have a little bit more power. Your passenger, you can help that passenger, the baby, find a good position with the spinning babies techniques, the exercises, being up and moving, mobile for as long as possible. And then if you choose to have an epidural, we will help you find positions that are better to help the baby descend into your pelvis also. But I tell you, if labor is held up, it's usually that little passenger that's doing it, right? Because that range of motion, even if you're head is tilted just to the side. Like if everybody does that right now and you try to tip your head back, you can't. But when your chin is in the middle, you can really tip your head back, right? Like nodding yes. But if you're going backwards, there's not a lot chin drop to your chest. There's not a lot of room that way. So that's that range of motion that you need. And then the psyche is your environment. If anybody has ever seen a dog or a cat give birth, they actually will stop their labors if you enter the room and pause